Good morning. Thank you all for the opportunity to be here. It's truly a privilege to be here and an honor to be part of such a distinguished panel. My name is Javeed Siddiqui. I'm from the University of California, Davis, up the road a little bit. I wanted to talk to you about telemedicine. The telemedicine program at the University of California, Davis was started over 10 years ago by a real visionary, Dr. Tom Nesbitt. And we were founded on one basic principle: increase access to specialty care for rural Californians. From that one idea, and that has remained our central mission. Over the last 10 years, we've done over 20,000 telemedicine consultations from UC Davis. I can honestly say there's not a single specialty in medicine that does not fit into telemedicine. Now, I'll tell you, we do neurosurgical pre- and post-operative evaluations through telemedicine. We do orthopedic surgery, my own specialty, infectious diseases, etc. So it really, I feel that telemedicine is only limited by one's imagination. So rather than talk about all this, I really wanted to show you what it is and what the power of telemedicine is. So if you'll allow me, I'm going to show you a video clip. So what we have here is we actually help 4 pediatric critical care centers throughout Northern California, and we manage them 24/7, 365 through telemedicine. Right? So here you see a critically ill child. In this rural hospital, there's only one pediatrician that works in the hospital. Right? Now, that pediatrician was actually stuck across town at his office. Right? This young girl was actually critically ill, had a Staph aureus bacteremia, was hypotensive, could not maintain her blood pressure. So what the team decided to do was to contact our telemedicine program. And here you see Dr. Krosh Parsipor. So they contacted him right in our own pediatric intensive care unit, and he was able to manage this child for over 2 hours before the physician arrived on the scene. And obviously this is bits and pieces of that discussion that they had. But I think it illustrates some of the key aspects what telemedicine allows you to do. And if you can do this 200 miles away, why can't you do this 2,000 miles away? Why can't you do this on the other side of the world? So what you have here is, again, so Dr. Parsipor here at UC Davis, this is at a rural hospital. As you see, he's not using any, outside of the standard telemedicine equipment, he's not using any other interface. What you see is him controlling the camera on the far end. Here are nurses who are involved working with him, and he's giving them orders exactly what to do. So if we step back in, so he's watching the child. Here he's able to see how the child is breathing, right? And notices, you know, I'm really not happy with exactly what's going on here, so I want to adjust the ventilator. So what he does is he zooms into the ventilator. He's able to see the flow volume loop and give them recommendations. No, I want you to change the ventilator settings because I see that her chest is rising too much. I think you're putting too much air into her lungs. Right? Then he goes up and takes a look at the standard monitor that's right by her bedside and focuses in on what's going on with her blood pressure. He notices that her heart rate is high, as you'll see. He focuses in here. Again, he's doing this real time. What's going on with her heart rate, what's going on with her blood pressure, and he notices that she has staphylococcal toxic shock syndrome because he sees the redness on her skin. And I apologize for the pixelation here, you might not be able to see, but he asks one of the nurses to come down here and help him do an exam and take a look at her perfusion. And you see that clearly here. And he says, she's really not perfusing as well as that we would like, so therefore we're going to change her blood pressure support medications. Right? And finally, as you can see what's going on, despite the changes they've made, her blood pressure hasn't responded, so he decides to do other things. And this child actually did very well. And at the last scene that you can see here, you see that the physician, the pediatrician from the rural center, from the rural hospital, rushing in and saying, "I'm here, and I'm able to." There he is, right there. I'm able to help take over the care here. Right? So this really speaks to the power of telemedicine, right? And this really speaks to what we want to do in telemedicine. Wait for a second. Here we go. Let me stop this here. Let's stop it. There we go. So what we hope to do with, as Dr. Sastry said, you know, healthcare is a $2 trillion industry in the United States. And one of the things as a practitioner I feel is that we're not very good at delivering services. I mentioned yesterday in the workshop we see a further sterilization of healthcare in the United States. We're very good at analyzing individual bits of data, but we're not very good at transforming that data into the human element. Right? And one of the things that I've always been proud of telemedicine is that telemedicine truly is the integration of technology to bring the human aspect back into healthcare. Right? Because if it wasn't for telemedicine, they might have been just simply calling our medical center and saying, what do we do with this child? What do you want us to do? And the video adds such a wealth of information and really allows the physician-patient interaction to be much more humanistic. Right? What we hope in the future is that this won't just occur at major medical centers, but we can be able to do this if we're able to stream broadband to our cell phone. Why can't I be on call, be anywhere, and be able to have this type of technology? Why can't I, rather than simply talking to my patient, do a virtual house call to be able to see what's going on with the patient in their own environment? Doctor, I have a rash. Well, describe the rash to me as opposed to taking out their cell phone, taking a picture of their rash, sending it to the physician, and him or her being able to take a look at it and go, I know exactly what this is. I have your pharmacy on my data set. I'm going to call in a prescription. That's, again, restoring some of the humanistic aspects of it. I know I have 5 more minutes to spare, but that's really what I wanted to discuss with you all, because I think the more important aspect is hearing your feedback and how you would like us to better utilize our technologies. And what I really look forward to is working with the researchers at CITRIS in order to help take this model and enhance it and improve ways that we can better deliver healthcare not only in the developed world. We'd really believe that this is a key element of developing it in the developing world, and Dr. Brewer and his colleagues have really done remarkable work in India with regards to their ocular health program. Really hope to build on that. Thank you all very much.